My name is Brian O'Rourke, and I'm a healthcare policy analyst at the Health Policy Institute of Ohio. The Federal Reconciliation Bill, H.R. 1, which is sometimes called the One Big Beautiful Bill Act, made major changes to state Medicaid programs. And one of the most significant components of this legislation for Ohio is the creation of Medicaid work requirements. Earlier this month, HPIO released a policy update focusing on how Ohio is preparing to implement these work requirements and important considerations for policymakers in the state. As a reminder, H.R. 1 work requirements will specifically affect the Medicaid expansion population, which in Ohio amounts to about 700,000 low-income adults. And to meet these requirements, expansion enrollees must have 80 hours per month of work or community engagement activities, which can also include educational programs. H.R. 1 clarifies that some people will be exempt from the requirements, including individuals who are pregnant, certain parents and caregivers, and people who are medically frail or have special medical needs. However, the legislation was not detailed in defining some of these categories. New estimates from RAND anticipate that about 170,000 Ohioans will lose Medicaid coverage due to work requirements by 2034, and evidence from prior attempts to implement work requirements in some states suggests that much of this coverage loss is due to administrative burdens like the need to submit additional documentation. This provision will also lead to significant funding loss in Ohio, over $12 billion in the next decade. Outreach to impacted enrollees is about to begin in Ohio ahead of a September federal deadline, and work requirements will officially begin on January 1st, 2027. States can request a delay of up to 2 years. However, the federal government has indicated that delays will be approved sparingly. Defining exemption categories like medical frailty is one of the biggest implementation challenges that states currently face. And in June, the federal government released guidance that created a stricter definition of medical frailty than what was in H.R. 1, specifying that an individual must not only have a serious and complex medical condition, but that it also significantly impairs their ability to comply with the requirements. If this guidance is finalized, it could cause individuals with significant health problems to become even sicker and possibly lose coverage entirely. States also have the option of implementing optional short-term hardship exemptions, including for enrollees who were recently hospitalized, travel frequently due to medical treatment, or live in counties with a high unemployment rate. However, the Ohio Department of Medicaid has indicated that Ohio does not plan to adopt any of these hardship exemptions. Analysis from KFF suggests that 15,000 enrollees could be exempt in Southern Ohio due to high county unemployment rates if the optional exemptions were adopted. Using state electronic data sources, the Ohio Department of Medicaid was able to verify that approximately 78% of expansion enrollees met work requirements or exemptions, as you can see in the graph. The other 22% would need to provide additional documentation to verify their compliance, including pay stubs or doctor notes. However, this analysis does not account for the stricter medical frailty definition, meaning that an even higher percentage of enrollees may need to verify their exemptions with documentation, which could also be burdensome for providers in the state. For more information, you can view HPIO's full policy update brief at the QR code on the screen. And to keep up to date with all of HPIO's work, you can join our mailing list with this QR code or visit our website, hpio.net.